Coming up on Mayo Clinic Q&A.
Oral cancer is basically considered within the oral cavity. But there's also, when we look at the statistics, is cancers of the oral cavity as well as the back of the throat or pharynx. It's about 3% of new cancers in the U.S. on a yearly basis.
Treatment for oral cancer depends on that cancer's location and stage. Treatment options can include surgery, radiation, and chemotherapy. But as the saying goes, the best treatment is often prevention, and there are some steps to take that can lessen the chance of contracting oral cancer.
The two main risk factors is tobacco use and tobacco of any type, as well as alcohol. To that, we see patients that are immunocompromised as another set of patients that have high risk factors. But when we think of risk factors that individuals that we can control, certainly is the smoking or tobacco use in general, as well as heavy alcohol consumption.
Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Siepin, sitting in for Dr. Helena Gazalka. Oral cancer refers to cancers that originate in the mouth, tongue, and back of the throat. Early detection of oral cancer can lead to better treatment options and outcomes. April happens to be Oral Cancer Awareness Month, a time to remind the public that there are steps to take to reduce your risk of developing oral cancer. Joining us to discuss those risk factors, prevention, and treatment of oral cancer is Mayo Clinic oral and maxillofacial surgeon, Dr. Kevin Arce. Welcome to the program, Dr. Arce.
Thank you. Thank you for the opportunity to be here this afternoon.
Of course. So let's start off with, how common is oral cancer?
So oral cancer is basically considered within the oral cavity. But there's also, when we look at the statistics, is cancers of the oral cavity as well as the back of the throat or pharynx. When we think of those cancers, together, it's about 3% of new cancers in the U.S. on a yearly basis. So it's approximately about 54,000 cases, that we see yearly here in the United States.
Okay, so would oral cancer be considered part of head and neck cancers, or are we talking a separate category?
It is it's one of the subsites of the head and neck cancers. And when we think of the oral cavity cancers, we got to think of the lips, the gums, the floor of the mouth, the roof of the mouth, and also the lining in the cheek area, as well. So all those would be the areas where we think of, and the tongue itself, but all those areas are what would be considered oral cavity or oral cancers.
What about, what are the risk factors for developing oral cancer?
So one of the two main risk factors is tobacco use and tobacco of any type, as well as alcohol, consumption, as well. And then, after that, we see patients that are immunocompromised as another set of patients that have high risk factors for developing cancers, because those patients don't have the ability for their bodies to fight cancers of any type, including this type of cancer. But when we think of risk factors that individuals that we can control, in some ways, it's certainly is the smoking or tobacco use, in general, as well as heavy alcohol consumption.
What are the signs and symptoms of oral cancer, and then how would it be diagnosed?
So one of the challenges with oral cancer is that when we think of the signs and symptoms, they could be very nonspecific. And that's why a lot of times it goes unrecognized, by both the patient as well as providers for a period of time before we figure it out that it's actually a cancer. But some of the most common signs that we see is a sore that doesn't heal, a lump or a bump, loose teeth, some patches that just look or feel different, and it's a new change, for the patient. And then we also see pain. So that's at times what is somewhat confusing is that at times these cancers don't cause pain. We all associate cancer with being a painful condition, which it can be, but not in its early phases, at times. So these lumps and bumps that can develop in the mouth at times are not painful, and that's why they go unrecognized. But those are the most common signs and symptoms that we see. And then also we can see, later on in the evolution of the cancers, ear pain, mouth pain, and also some difficulty with swallowing.
Okay, interesting. What's the typical treatment?
So the typical treatment is, once we evaluate a patient, we go ahead and have to do a biopsy, because even if it looks abnormal and somewhat what we call suspicious, just doesn't look like it should be, that it belongs there and it's worrisome for a cancer, we go ahead and do a biopsy. Once we get confirmation that it is a cancer, then the oral cavity cancers within the head and neck cancers are predominantly treated with surgery first, because for one thing is we can get to them and we can actually remove them. And then once we do that, then we go ahead and do other treatments such as radiation therapy and chemotherapy. It's not for all patients. It depends on the size of the extent of the involvement of the cancer or how big it is. And also if these cancers do have a tendency to go elsewhere, in the body, but elsewhere, the lymph nodes do a good job of filtering them. So when we think of treatment, most of the time we're treating both the cancer where it starts in the oral cavity, but also doing some sampling of the lymph nodes or so-called neck dissection, as well. And that's going to determine whether patients then need extra treatment like radiation therapy or chemotherapy or both.
Does Mayo Clinic approach treatment differently?
Well, the approach is similar to what the guidelines are of other cancer centers across the country. We have an integrated practice, so the communication with other disciplines or other specialists such as medical oncology and radiation oncology is very seamless. So it's very straightforward in that aspect. We do have technology that can be unique to some centers, for example, for the proton beam therapy, which is along the lines of radiation type treatment that are given to patients with these type of cancers, at times.
Let's talk about the advances being made in surgery for oral cancer. So starting with anatomic modeling lab and 3D printing. What can you tell us about that?
Yes, absolutely. So one of the advances that we've seen in the last 20 to 30 years in the treatment of head and neck cancers certainly has to do with the reconstruction. We have better abilities to reconstruct the structures that have been lost because as part of the cancer we have to remove not only the cancer but also surrounding the tissue that is time normal tissues, and to replace that can be quite challenging. But we've made advances in general in the treatment of head and neck cancer, so we can bring tissues from different types, different areas of the body and reconstruct either a tongue or rebuild a jaw. When it comes to jaw reconstruction, the anatomical lab 3D printing has helped tremendously because we can do a patient-specific type of reconstruction, so we can replace what's been lost and place it in where it was prior to the surgery. We can replace what's been lost, but also make sure that the function is there after this type of reconstruction. Here at Mayo Clinic, we also have the discipline of maxillofacial prosthodontics, which allows us to not only replace the tissue parts, but also the dental alveolar. And what I mean by that is basically replace the teeth, the dentition, as part of the comprehensive reconstruction, which is important to be able to restore form and function so patients can obviously speak, not only look the same, but speak, eat, as they did prior to the surgery. And at Mayo Clinic, we can also do that, all in-house, within the institution. We have a group of neuroradiologists, biomedical engineers that are part of the institution, and we collaborate with them in these types of reconstructions.
Great to hear about those advances for sure. Dr. Arce, is there anything else that you'd like to share? Anything else that you think is important for people to know? I
think it's, the awareness is important. It's when we think of percentage of cancers, new cancers in the United States, per year, it would be considered relatively low. But I think it's still the awareness that oral cavity cancers do happen. And it's also important to maintain that relationship with either your dentist or your primary care physician, that they do at least an annual screen of the oral cavity to make sure that there is nothing unusual or a lesion that needs more attention.
Very good. Well, our thanks to Mayo Clinic oral surgeon, Dr. Kevin Arce, for being here today to discuss diagnosing and treating oral cancer. Thanks so much, Dr. Arce.
Thank you.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.